He felt fine until he wasn't. No pain, no warning, just pressure building quietly year after year. High blood pressure, often called the silent killer, affects more than 70% of people over 60. Yet the vast majority don't even realize it's there. Why? Because in seniors, the symptoms are easy to overlook. Maybe a little dizziness, a touch of fatigue, or a slight headache now and then. These signs are subtle, so easy to brush aside, so easy to miss. But behind them, the heart is working overtime, struggling in silence. Unchecked, high blood pressure quietly damages vital organs. It wears down the heart, strains the tiny vessels in the brain, and over time, can seriously harm the kidneys. It's one of the leading causes of stroke, heart attack, and even dementia. All those threats, building up day after day, without a single obvious symptom. But what exactly is high blood pressure? Imagine your heart as a pump, pushing blood through a network of tubes, your arteries. When those tubes are healthy, blood flows smoothly, easily. But as we age, arteries can become stiff or clogged, making it harder for blood to move through. The heart has to pump with extra force to keep everything moving. That extra force is what doctors call high blood pressure. Most times, you won't feel a thing. That's why it's so important to check your blood pressure at home, especially for our parents and grandparents, because the only way to know for sure is to measure it, regularly and with care. So, how can you start monitoring blood pressure at home? It's easier than you might think. Begin with an automatic arm cuff. These are more reliable than wrist monitors. Try to measure blood pressure at the same time every day. Morning is usually best, before breakfast, and before taking any medications. Make sure to rest for at least 5 minutes beforehand. Sit upright in a chair, with your feet flat on the floor, and avoid talking during the measurement. Write down the results in a notebook, or use a simple phone app to keep track over time. For most seniors, the target blood pressure is below 130/80. But remember, everyone's different. Always follow the advice of a trusted healthcare provider. If you notice blood pressure readings that are high several days in a row, don't wait. Call the doctor. Early action can make all the difference. High blood pressure can't be seen or felt, but it can be caught, early and easily, with a little consistency, care, and most importantly, love. Checking blood pressure at home is one of the simplest ways to protect the people we love from life-changing illnesses. It's a small habit with life-saving potential. So, whether you're caring for a parent, a grandparent, or yourself, remember, knowledge is power. High blood pressure doesn't have to be a silent danger. With regular checks and a little attention, you can help ensure more healthy days, more smiles, and more precious moments together. Because the best kind of care isn't just about medicine, it's about looking out for each other every single day.